To access the Stop Smoking Clinic template, you can go to Auto Consultation, Arden's Nurses and HCAs, and Stop Smoking Clinic. And if you're using this template regularly, you may want to consider adding it to your F12 Favorites key. So here I've already added it, and I can press F12 followed by S to go directly to the template. And we've got some separate instructions on how to configure your F12 Favorites. So here you can select the type of appointment you're doing. So we'll start with the assessment appointment for the patient's initial assessment. Any field on the template that's indicated with a blue star tells you that's required for an enhanced service payment. You can also see a red star next to the smoking status. That indicates that's required for a QOF payment. So here I can select the appointment type, also the source of the referral. I can record the patient's occupation and also their ethnicity. And also by simply selecting the field, I can see what's already been recorded in the record. Whether the patient's currently pregnant or breastfeeding, or whether they have a history of mental health. I can also record their cigarette pack years and their carbon monoxide reading. I've also included a link to the cigarette pack years calculator. So if I select this, it takes me directly to the website where I can input the number of cigarettes per day and for how many years, and it will update the cigarette pack years at the bottom. And this is slightly more accurate and a bit more flexible than the built-in tool with System 1. You also have a link to the smoker life expectancy calculator, a link to the vitals and lifestyle template should you need to update any other aspects of their vitals and lifestyle, and also a link to the COPD screening template. And these questions should be completed on any patient that's over the age of 35 and is currently a smoker. I can record whether the screening is normal, or if it's abnormal, I have instructions on what to do next. I've got a free text area for any notes. I can also update the patient's smoking status, or again, just by selecting the field, I can see what's already been recorded, whether they use an electronic cigarette. I can input any aims and goals, and also their readiness to quit. I can input a quit date. I can also use a date shortcut in here, so I'm going to type 4W and enter on the keyboard to forward 4 weeks. I can also record brief intervention has been given along with advice, and I can also give a leaflet. I have a link here to the smoking cessation formulary. If I click this, I'm going to select nicotine replacement therapy, and in here I can simply select one of these buttons to produce the prescription. I also have a link to the follow-up template, so I can go ahead and book the patient their follow-up appointment. And also a link to a summary leaflet, so I can print off a summary of everything that's been done in the consultation. Now please remember, in order for the summary leaflet to merge everything that you've done, you need to OK and reopen the template, or alternatively you can press suspend, and then you can resume the template with the resume icon up at the top. Or here under patient, I can select resume. You can also see that the keyboard shortcut for this is Control and F4. So if I go back to the assessment appointment and now press summary leaflets, and right now, the leaflet will come up and everything that I've done in that appointment will merge. Of course, I can print that off for the patient and then save the final version, and that becomes part of the patient's record. If your surgery offers a quit date appointment, on the quit date appointment tab here, you can update the carbon monoxide reading and the smoking status as appropriate. You can also update the patient's readiness to quit or their quit date, and also print off a summary leaflet of that consultation too. And when it comes to the patient's follow-up appointment, the follow-up appointments tab allows you to record the patient's status at 4 weeks. You can also add a carbon monoxide reading and their last tobacco use, and whether their quitting has been confirmed by a carbon monoxide reading of less than 10 ppm. I can update their smoking status as appropriate, whether they're still using an e-cigarette, update any aims and goals, and also, if appropriate, I can still update their quit date if they're going to need a further follow-up appointment. I still have my links to the leaflets and the smoking cessation formulary, along with a link to the follow-up template where I can book any further appointments, and also a link to the summary leaflet.